Yes, I'm Cameron McBride. I'm the Director of Digital Technology Services here at Western Health in Victoria, and Adjunct Professor at Victoria University. Yeah, so I think the driving factor was that we needed to have high availability for our Citrix environment, and getting access to our electronic medical record. So the way that we sort of looked at that is we wanted a endpoint that could seamlessly transition us from using Citrix if there was a Citrix issue. We've done a lot of work to make Citrix highly available, but there's a lot of variables that could go into making that not the case. So we had the ability with IGEL to transition to Azure Virtual Desktop in the event that Citrix became unavailable, and then we'd still be able to gain access to our electronic medical record, which was really important for the business. There's a couple of elements to high availability. I mean, security was also a big factor, but beyond having that business continuity of how we access our electronic medical record, the serviceability of the IGEL solution was very good. If you think about healthcare, we're sort of 24/7 in a lot of services that we run. So we couldn't have a scenario where we could just take a think line out of production for an hour just to update, have all its updates apply. So having the update process be relatively seamless with IGEL, that sort of updates that secondary petition, and then once it's good to go, you just swap over, and there's an effective rollback in the event that that update is unsuccessful. That was really important for us. We knew that we needed our think lines to be available always for our staff, but we also needed to make sure they had the appropriate updates and continue to be secure. Yeah, absolutely. I think there's been a speed factor in the way that we've been able to see Citrix launch, and the portability of our user sessions going from one thin client to another. It's worked out really well. Well, I think for us, it's been important that it's been consistent. So we had a range of different ways that we were delivering the operating system to those thin clients previously, and that sort of ended up with a more fractured environment. So there was a challenge for some of the users in how they were interacting, but importantly, that meant that we had inconsistency in how we were delivering the service, which led to an increase in problems and how we managed them. Whereas by being able to align all of that hardware under a single view and a single operating system, we got the benefits of having a high level of consistency, whether it's a Citrix receiver or other applications that sit on top of IGEL, but knowing that we had consistent operating system, consistent configuration of how those thin clients looked, really reduced the number of incidents we were getting as a result. Yeah, so I suppose compared to our previous environment, IGEL do a good job of having that trust chain of how all the software that is on that environment is verified and in the appropriate place. So when we were using the previous embedded operating system, we just didn't have that level of comfort that the software that was running on that operating system was pre-approved and up to date and running the libraries that we wanted to. So now having IGEL, knowing that there's that trust chain of how that software is delivered, means that it's a relatively small software operating system anyway. So reduced surface area. It's not an operating system that's trying to do everything. It's quite modular. You can sort of break it down to deliver just the services that you need, which reduces the attack surface as well. So that's been really good win for us as well. Yeah, so I mean, that's something that we think about a lot at Western Health. One of our core principles is around sustainability. So you think about the amount of e-waste that gets generated because, a software vendor makes an arbitrary decision that they're no longer going to support a certain piece of hardware. That's quite significant. We had hardware that was perfectly suitable. It was relatively new in terms of its life. However, the software just happened to get to a point where the software couldn't be supported. So while the hardware was relatively young, it was moving into the end of life territory, which was really kind of frustrating. We didn't feel like there was anything wrong with the hardware. But, we work in an environment where we need to know that there's a vendor that's going to support that setup. So having IGEL sort of step in and play that role of having support for the software that's running on that hardware and making sure that it's still secure and maintained, that was a real win for us. We get to see a longer life out of the hardware that we have. We get to unify all the different hardware models and manufacturers that we'd had previously. In some cases, we get to redeploy existing computers into being repurposed as a team client. It gives us plenty of options, but importantly, we're ultimately reducing e-waste that would otherwise exist if we didn't start using a more contemporary operating system. So I mean, again, you end up being on this treadmill depending on which operating system provider you have, whether you need to go down, a long service branch around supportability to maintain the consistent, the current version, unless you're constantly doing those relatively impactful operating system upgrades. So avoiding that alternate license cost is useful. Often when you're running an operating system, you've got to buy a whole bunch of other agents to make sure that is able to be supported, making sure all your cyber security criteria, whereas trying to minimize that to just having the IGEL operating system take care of the majority of that function is also an offset from a licensing perspective. So, I mean, for us, the thing that the team really was keen on was making sure that we had that business continuity plan in the event that things were disrupted. We had a great pathway for the business to get back online and access to key data and key applications. So that provides a high level of comfort, knowing that we've got an architecture that is fairly significantly resilient, touch wood. That's a big win. I think, within IT environments, you ultimately just want to see less incidents get generated. It's hard to do problem support effectively if you've got different consoles needed for different hardware sets that have, different policy applied. Unifying all of that, having consistent deployment of that configuration across the fleet has just been a really big win for us, that we can reduce those incidents quite significantly. Yeah, so, we're a fairly fast-growing health service. We've got a $1.5 billion new Footscray hospital that's going live next year, which we're really excited about. We've also got a $1 billion Melton Hospital, which will go live a few years after New Footscray Hospital. Allowing our clinical environment to be based on IGEL makes that a delivery of IT services more secure, but also make sure we have the resiliency and high availability that the business is asking for. Another area that we're sort of looking ahead in the future is within the enterprise browser space. So bring more of the functionality to IGEL and not necessarily jumping out to a Citrix environment in all situations. It's sort of a reduction play potentially. But it's good to see the IGEL ecosystem continue to grow. There's partners that we were already working with that sort of attracted us to IGEL in the first place, but they continue to grow with other partners that help solve some of those complex solutions that exist in healthcare.